In Lifting Depression, I tell extensive stories, case histories about some wonderful people it's been my privilege to see over many years. And while psychoanalysis and psychotherapy they credit in many instances with saving their lives, improving the quality of their life, did not address the underlying depressive symptomatology, the depressive feelings, the sluggishness, the tiredness, the restless sleep, the difficulty concentrating. And when I, by accident, gave these people Chromium to see those symptoms relieved was truly astonishing. It was a wonderful and joyful segment in my life, to be sure. And I relate this in considerable detail in the book. The discovery that Chromium plays a role in mood regulation is revolutionary. And its importance has been recognized by the scientific community. It's been published in 3 separate peer-reviewed journals, and the U.S. Patent Office recognized its originality by offering patents covering these discoveries. So I am positive that it is new and revolutionary in that regard. Atypical depression is a misnomer. In fact, it is the most common type of depression. It is depression associated with excessive appetite, particularly craving for carbohydrates, unexplained exhaustion, feeling sleepy or groggy too much of the time, and for some inexplicable reason, excessive sensitivity to rejection is found in this symptom cluster. Atypical depression is to melancholic depression, the type with the weight loss, as a summer thunderstorm is to a long gray winter. The onset of atypical depression tends to be gradual, it's chronic, it can come on in the teenage years, even childhood, and can last a lifetime if untreated. So unquestionably there's more morbidity and suffering from this quiet onset type of depression than there is from the type of depression that comes on rapidly and is associated with weight loss and severe insomnia. The most difficult part of this journey was understanding or forming a theory about how Chromium helps in mood regulation. Chromium is well established as an insulin sensitizing agent. Insulin being one of the master hormones in the body that affects many organs. And when insulin is not acting efficiently, when the body is not sensitive to it, in some unknown way, I believe this dampens down the manufacture of the chemicals in the brain, catecholamines and serotonin, that are involved in mood regulation. And when the body is sensitized to insulin by Chromium, it allows the brain to make those chemicals that are necessary to maintain a healthy, non-depressed mood. This was almost entirely deductive reasoning following reading of thousands of scientific articles, discussing with colleagues, piecing together bits of data from interviews with my patients. And I am pleased to report that in the year 2000, a Czechoslovakian, Jiří Horacek, his name, demonstrated, in fact, that there is a connection between insulin sensitivity and the manufacture of serotonin in the brain. And Chromium increases the body sensitivity to insulin and in some way increases serotonin and lifts depression. In Lifting Depression, I tell the reader what the manifestations of the insensitivity of the body to insulin are. The major symptoms are a tendency to gain weight, especially around the abdomen. One of my patients said, yes, they call me the Michelin Man, or I call myself the Michelin Man. I've got a spare tire. That's one of the manifestations. A second manifestation is high blood pressure. Approximately half of the people who have high blood pressure have insulin resistance. The good cholesterol, the HDL cholesterol, the one that cleans out plaques in arteries, tends to fall when a person's body is not sensitive to insulin. So some people may have only one of these signs of insulin resistance, while some other people may have them all. People who are particularly prone to develop insulin resistance, the shorthand word for the insensitivity of the body to insulin, have a blood relative who has diabetes or high blood pressure, heart disease, and women who have been diabetic during pregnancy, gestational diabetes it's called. Those people are more subject to develop insensitivity to insulin than others might be. One of the most difficult and confusing early parts of the discovery process was learning which preparation helped and which did not. It was clear that some patients responded to one preparation while other patients did not, and the same patients would respond to one preparation and then not another. I eventually, and my patients eventually, concluded that there's more than one good preparation of chromium picolinate out there, but unfortunately there are a number of substandard. The preparation that I am more comfortable recommending, the one that I recommend to all of my patients, is Chromax chromium picolinate. The company is concerned about quality assurance, and the response to Chromax is regularly positive in people with atypical depression. Some patients require an antidepressant medication and chromium. Chromium seems to increase the efficacy of and reduce the side effects of synthetic or pharmaceutical type antidepressant medications. There are other people who benefit from chromium alone. I could hardly believe that observation, but extensive single-blind studies confirmed it in my work. One of the very great advantages commented on by every patient who has responded to chromium picolinate is that it is free of any unwanted side effects. That is so unlike standard synthetic antidepressant medications that, while very necessary and even life-saving in some individuals, are almost always associated with some onerous side effect, and chromium is free of those.